Hello, everyone. We did our assignment on the cycles approach. Our team was myself, Abigail, and Cassie Weathers. The cycles approach is a therapy model in which the clinician identifies the client's phonological patterns that are weak yet stimulable, and they present them cyclically to increase intelligibility progress for the child. So essentially, we are trying to facilitate the emergence of those phonological patterns. The primary populations for this would be for children that are highly unintelligible and have multiple speech errors. It's most appropriate for those that have severe to profound expressive phonological impairments. We typically want those children to have less than 20% intelligibility for them to be the primary population that we're working with. This can often look like children that suffer from childhood apraxia of speech, and we're typically targeting children from ages 2.5 to 14 years old. Other populations that can be addressed with this cycle would be those who suffer from recurrent ear infections, mild to moderate and severe hearing loss, children with cochlear implants, repaired cleft palate, and cognitive delays. Some distinguishing characteristics of this model would be the ordering of phonological processes based on developmental norms and the child's abilities. So, the child's severity levels and errors in sound patterns help us to determine the targets. Again, we want those targets to be stimulable. Our objective here is to provide the child with the opportunity for immediate, tangible success. So, it's recommended that we order therapy targets from primary to secondary to impact the overall intelligibility and age of acquisition. Sounds that are required earlier are more likely to increase intelligibility, so those should be targeted first. Diving in a little bit more to the therapy targets, again, they should be selected based on the child's phonological pattern deficits. They must be stimulable and consistent. Some exceptions to that would include liquids. Even if they're not stimulable, they should still be addressed. They, again, are divided into primary and secondary target patterns. So the target patterns, the targets are prioritized based on the age of acquisition and their impact on intelligibility. So the sounds that would, consonants versus vowels, and non-stimulable sounds are still addressed, but not quite so directly. They are addressed for maybe a few minutes per session until they become stimulable, and then they would be added to the cycle. So some of the primary targets would be word syllable structures, so like omissions, S clusters, anterior and posterior contrast, so velars like words with final K, initial K or G, again, the liquids, and the KR and GR clusters. Secondary targets will include palatals, single stridents, and other consonant clusters that are more than two. You can also incorporate minimal pairs in practice when possible. This is an example of a planning sheet. So you would put a check mark beside the phonological processes that you're identifying. Be sure again to choose the ones that the child is stimulable for, and you're going to choose about 1 to 3 targets per cycle, and you're going to focus on these cycles for about each target for about 60 minutes of therapy, and then move on to the next, which would typically be the next session with the child. Some key protocols and procedures for this would be, again, to target stimulable phonological patterns rather than individual sounds. So we're looking at the patterns, not one specific sound. We're going to target each phoneme within a pattern for 60 minutes per cycle. Be sure to, again, we're recycling those patterns until they emerge in spontaneous speech. You're going to want to begin and end each session with auditory stimulation and use production practice words to help build accurate kinesthetic images.
Cycle approaches are great for individuals who are highly unintelligible and present multiple phonological processing. So what we could do is we could break up the cycle into 4 different groups. Each group contains a certain target or certain amount of targets that we will work on each week, and each target will be for 60 minutes for 1 week. So for example, we could do group 1 as for stopping, and that could be our groups 1 through 4. Group 2 could be our S cluster reduction, and that could be grouped for weeks 5 and 7. Group 3 can be worked on fronting, and that could be for weeks 8 and 9. And group 4 could be gliding, and that could be for weeks 10 and 11. So for group 1, We would work on one sound per week for 60 minutes. So we would break that down into 4 different weeks. And so the first week we would work on our S sounds only. The second week we would work on our Z. The third we would work on a th. And the fourth week we would work on a sh. After the SLP has completed that round, we would move on to group 2. And our group 2 could work on our S cluster reduction. So week 5 we could work on the sm. The group 6 we can work on sk. And group 7 we could work on st. After we work on those targets for 60 minutes, we will move on to group 3, which would be week 8 and 9. So week 8 we can work on the sound, and week 9 we could work on the k sounds, since we will be working on fronting. And then on our final group would be gliding, and we could work on the r sound and the l sound. And after week 11, the SLP would decide if another cycle needs to be done or if we are all finished with the cycle approach.
We've taught you a little bit about the cycles approach. We are going to do a demonstration for you about what this might look like in an actual therapy session. While we don't have a full 60 minutes to do this, we've kind of shortened it down just to give you an idea of what a session might look like beginning to end, the different activities that might be included. In this session, I will be acting as the SLP and Casey will be acting as the child. And this child is working on final consonant deletion. That's our target. And specifically for this session, it's going to be the final P sound. Okay, good morning. Okay, so remember last time we were working on sounds at the beginning of words. Today we will focus on sounds at the end of words. I'm going to start by saying some words and making the end sound really strong. You don't have to say the words, I just want you to listen, okay?
Okay.
All right. Top, mop, cop, bop, hop, map, nap, lap, sap, tap, gap, rope, soap, cup, up. Did you hear how I said those end sounds? They sound nice and strong. Now we are going to practice together, and I want you to say those sounds as strongly as I did. I'm going to show you pictures of the words. I'll say the first word and you repeat it.
Okay.
All right, so this is our first word right here. Oh, doesn't want to show up too well. Hold on. Okay, let's try that again. There we go. All right, this is a mop.
Mop.
Great job on that end sound. All right, let's do another one. Okay, this is a cup.
Cup.
Good try, but I didn't hear that end sound. Let's try that again. Cup.
Cup.
Much better. I heard that end sound that time. All right. Our next word is map.
Map.
Perfect. All right. We're going to try taking turns now. So I'm going to say the word on the card, and then you will do the next card, and then we'll kind of go back and forth. But we want to keep focusing on those end sounds. All right? Okay. So it looks like this is my word. This is hop. All right. Now it's going to be your turn. So let's get your picture ready. All right, this is your picture right here.
Nap.
I didn't quite hear your end sound that time. Remember how I said my end sound did hop? Let's try that again with that one.
Nap.
There it is. Okay, awesome. All right, now my turn. My word is soap. All right, now your turn. Let's see. All right, here's your word.
Rope.
Awesome job on that end sound. All right, we're all done with that. Now I'm going to have you repeat some words with different end sounds to see what we should work on next week. It's okay if you don't get them. We're just trying them out. All right, our first word is cat.
Cat.
Okay. Lab.
Lab.
Mad.
Math.
All right, great. For the last part of our session, I'm going to say those same words I said at the beginning. Again, you don't have to say them back. I'm just helping your brain to remember those end sounds, okay? All right. Top, mop, cop, bop, hop, map, nap, lap, sap, tap, gap, rope, soap, cup, up. All right, we're all done for today. Okay, so this was just a quick example of what a session might look like using the cycles approach. Like I said, this session was much shorter than it would be in real life. A normal session is going to last around 60 minutes, and typically going to start with a review of the previous session's words, if there was a previous session, of course, and then move on to the auditory bombardment, which is what you saw me doing at the beginning, where I was repeating the words, and the child just had to sit there and listen, didn't need to respond or repeat the words at all. And this kind of just helps with that auditory discrimination, so they're hearing the sounds and picking up on those, and hopefully their brain is working to start using those sounds and recognizing those sounds. After that, we move to like the target words. So a lot of times you can use like flashcards for this with images. You always want to provide a model first as an SOP. So some of the words I used, like cup, map, you want to provide that model and then have the child repeat it back to you. And then once you're kind of finished with those words, you can move on to, you want to do an activity, either like a turn taking, you can put it into a game. We just did a turn taking for this example, but you can absolutely take those words and bring it into like a game as well. You just kind of want to be taking turns saying different words to kind of help stimulate the child into producing these words spontaneously, because that is the ultimate goal in the cycles approach. We want the children to ultimately move into saying these words spontaneously in their speech. So doing that turn taking helps them be a little bit more independent in that. And then what you saw close to the end there that I was doing was a stimulability probe for the next session. So again, we were still doing those final consonant deletion words, just with different ending sounds to see what sounds the child might be stimulable for. So in this case, the ending B sound, lab, the child was able to say that ending B sound, which does make sense considering we were working on P, and a B is very similar, both bilabial sounds. So typically you would probably choose that sound for the next session. And then, of course, at the end, we finished with just a repeat of that auditory bombardment. Again, the child does not have to repeat anything or say anything. We're just having them listen to us say those words and emphasize the ending sounds to really help it stick in their brain. And then one thing we did not include in the video but is also important, an SOP will provide caregivers with a list of target words, probably the words that were being used during the session, and just send those home for daily practice. It only needs to be about 2 minutes a day for them to practice, because again, we want them to start incorporating this in their daily life, and we want this to become, spontaneous production rather than just repeating what we're saying.